It's been confirmed tonight that more than 150,000 people have now died in the UK after contracting COVID. 2 years and 1 day since COVID-19 was first identified in China, the UK has become the 7th country to reach that terrible milestone. Well, here's the latest data released just a short time ago. Another 146,390 new COVID cases have been recorded today, as well as 313 new deaths within 28 days of a positive test. Well, that means the total number of deaths now stands at 150,057. Our political correspondent Rob Powell is in Westminster for us tonight. Rob, an extraordinary figure, isn't it? 150,057 deaths 2 years into a pandemic. Pressure surely mounting on the government now to respond to that. But they, of course, say that Plan B was put in place precisely to stop the spread of this variant.
Yeah, and I think what the government will point to when it comes to the question over what happens next with restrictions is the fact that whilst the case numbers you outlined there are far higher than they were back at the January peak this time last year, the death rate is obviously far lower. This time last year, we were seeing 1,200, 1,300 deaths. That was the peak per day this time last year. We're obviously at 300 today, and some figures that have been lower than that in recent days, despite confirmed infections being the highest they have ever been. So whilst, yes, this is a sad milestone that is being passed, I think the government will continue to make the argument that the vaccination programme and the booster campaign is bringing down deaths substantially. And indeed, that's what the government have said in a statement that they've put out in response to this point being reached, in which a government spokesperson has said that every death from this virus is a tragedy and our sympathies are with everyone who has lost loved ones. We are thankful for the collective national effort and the hard work of frontline health and social care staff and volunteers for administering vaccines to tens of millions of people and keeping people safe. Their tireless efforts have saved thousands of lives. But the pandemic is not over. That's why it's so important everyone continues to play their part by coming forward to get boosted now or getting a first or second jab if you have yet to do so. Now, obviously, the thing that has radically changed how the government is handling COVID now is the vaccination programme, the impact that that has had both on hospitalisations and deaths. And I think that is part of the reason why there is, I think, an increasingly hardening view within government about what bar needs to be passed in order to justify more restrictions. I think just before Christmas, you were when less was known about Omicron as a variant and the information, the data was more uncertain about its severity, it did look like we were on a path to potentially tighter restrictions and potentially curbs on indoor mixing. I think we are in something of a different place now. You got a sense over the Christmas period that within the Conservative Party and indeed within Cabinet that they put their foot down somewhat around going for more restrictions without having the data there. I think the government has been buoyed somewhat by data showing that, yes, whilst hospitalisations have increased recently, the number of people requiring the most intensive therapy and intensive treatment has not necessarily gone up at the same rate. So I think that is why, at the moment, the position the government is in, for England anyway, is potentially one that we may well not see further restrictions ramped up in the short term anyway. All of that said, I think there are several big caveats to that. Schools went back last week, and we're yet to see, I think, the impact that that sort of mixing has on the case rates and the hospitalisation rates. We've potentially not quite seen the full impact of the Christmas and New Year period of mixing on hospitalisations and deaths as well. So it could all need a course correction if that turns out to be bad. But I think as we reach 150,000 deaths, there will be those that potentially not today making this point, but will do in the future, that, of course, the impact of COVID is not just counted through people who lose their lives to COVID. It's also counted through the impact it has on everyone's lives, on their education, on businesses that are disrupted. And I think that is why there will need to be a very pressing case made if we are going to see severe restrictions put in again in the manner that we have had in the last 2 years.
Yeah, it is a complex picture, isn't it? Rob Powell, thanks very much indeed for that.